Hello everyone. My name is Faiza Ahmed, a current resident at DMC Sinai Grace Hospital. Today I'll be presenting to you a single-center retrospective study on the outcomes of tricuspid valve and right ventricular function after right ventricular transvenous lead placement in patients with tricuspid valve prosthesis. This study was conducted as a collaboration between the Department of Cardiothoracic Surgery and the Department of Cardiology at Henry Ford Hospital in Detroit, Michigan. The aim of the study was to evaluate the outcomes in tricuspid valve and right ventricular function in patients with a tricuspid valve prosthesis, who then underwent placement of a right ventricular transvenous lead. Background research before the study showed that there is a well-known association between right ventricular lead placement and worsening of tricuspid regurgitation in native valves, with subsequent worsening of heart failure. Also, in patients who have undergone tricuspid valve repair or replacement, a subsequent RV lead placement for either pacemaker or AICD purposes is common. In fact, a review of literature shows there is an up to 8-fold increase in risk of RV lead placement after tricuspid valve repair or bioprosthetic replacement. In this study, we looked at the outcomes in tricuspid valve regurgitation and right ventricular function in a post-surgical population. We conducted the study by gathering data from a single center on patients who had undergone tricuspid valve repair or replacement between the years of 2000 and 2020, followed by first-time transvenous right ventricular lead implant. The primary outcomes studied were a change in tricuspid regurgitation severity as well as change in right ventricular function. The level of tricuspid valve regurgitation was defined as none or trivial, mild, moderate, moderate to severe, or severe. Right ventricular function was also defined as normal and mild, moderate, or severe dysfunction. Baseline echocardiogram data was reviewed before right ventricular lead placement, and follow-up echocardiogram data of time to death were recorded. We identified 52 patients who fit the inclusion criteria. 29 of these were female, 23 were male. 47 out of 52 had hypertension. 41 out of 52 had atrial fibrillation. 49 of these patients had tricuspid valve repair, while 3 of them had had tricuspid valve replacement. Median time from tricuspid valve surgery to lead implantation was 1.7 months. Median follow-up to last echocardiogram was 39.7 months. In patients who underwent tricuspid valve repair, there was none or trivial tricuspid regurgitation in 15 patients and mild regurgitation in 21 patients, 30.6% and 42.8% respectively. Right ventricular function was normal in 33 patients, which comprised of 67.3% of the total subjects. In this group, 58% experienced worsening tricuspid regurgitation with mean worsening by 0.9 levels. In patients who had a tricuspid valve replacement, no change in regurgitation was seen. However, there was a worsening of right ventricular function by 0.9 levels. There was a statistically significant correlation with high level of right ventricular pacing and right ventricular dysfunction, with a Spearman correlation coefficient of 0.37 and a p-value of 0.017. No such correlation was found with change in tricuspid regurgitation severity. 22 patients died at median follow-up of 48.9 months. In conclusion, our study showed that presence of a right ventricular lead after tricuspid valve repair correlated with worsening tricuspid regurgitation. It also found a correlation between higher right ventricular pacing levels and right ventricular dysfunction, but no correlation in regards to tricuspid regurgitation severity. Thank you all very much for your time today.